We're now in the acquisition phase bar screen. This is my favorite screen in all of 4.0. Several points about this screen. Klim, particularly for its entry work, is a real fan of what we call correlation. In 4.0, it's now called generic copy or BioCopy. The beauty of this software is even with generic copy, and sometimes my gray matter goes back to correlation, I may occasionally throw that word in, but BioCopy will provide the option to have opposing arch with a buccal scan. Now, that's the best of all worlds. Particularly in the future when you start feeling comfortable going with more teeth within a virtual die design process, it's all there for us, folks. That means you have more than 3 catalogs if you need them. For instance, I just did a case where I used biogeneric individual on the lower arch, and then on the upper I used biogeneric in one of the teeth. I chose to use BioCopy. Therefore, that means I need more than 3 catalogs. I placed in a 4th catalog for the BioCopy, which would be the correlation or the scan of the wax up. This really provides a nice handy tool for us as we set up our software design and workflow. A few other points about the acquisition phase bar screen. If you take your cursor down to the bottom of the page or hit that green plus, that opens up the image catalog. That's where we can review our images once we've taken our scan. Remember the reference frame? That used to be that red outline of a frame going way back in CEREC. Now we see that little green and white dot combo. That's the reference frame. If you ever see that you're not stitching, you may want to look back and see where the reference frame is. Usually with a quadrant, it's a no-brainer. There's enough data where your various catalogs will be able to stitch together. Another nice feature on the acquisition phase bar screen, particularly when you're doing BioCopy, after you take the impression of your preparation quad, you'll notice that when you turn the camera off, the computer at that time aligns the BioCopy over your preparation. It's really a cool look. It will allow you to assess several things at this stage of the game. Number one, how about occlusal clearance? As dentists, we're very visual. You're able to assess your preparation with a transparent overlay of your BioCopy. A very nice feature. There are a few other features of the phase bar screen. Down at the bottom of the screen, when your image catalog is on, you'll see a few filters. You can take an impression of your impression. We'll review those elements in another video, just to let you know it's there. I think right now, just stick with the basics as we've just described. Okay, now I'm going to share something really cool with you. Are you ready? Actually, how about if I share 2 cool things with you? See, I'm from the 70s, and in the 70s, cool was really a good word to use. You know, I grew up in Hawaii, and then another word was funky. See, now, whenever I use that word, the camera guy behind that lens of yours, he just cracks up. And he's probably saying funky in his dreams now. But let's talk about some cool things of CEREC 4.0. Number one is the buccal scan. This is how Klim takes his buccal scan. I prefer to take the scan before I prepare. In other words, I don't want the patient open like a crocodile where the joint's going to be stretched, and often it can sublux down, which means you don't get an accurate occlusal interdentation. In other words, we run the risk, if we take our buccal scan after we prepared, or where the joint hasn't fully seated, which means the posterior restoration is going to be high. Maybe a few microns. Remember, our hair is about 100 microns. In some of my sensitive patients, they will be sensitive down to 3 to 5 microns. I have the technology to measure that. So it's real important to get a good buccal scan. This is how Klim does it. We'll provide anesthesia. Once the anesthesia is accomplished while they're going numb, we're going to go ahead and take the opposing arch slightly from the buccal. Using the clear shot really makes this easy. The clear shot is provided for us by Chris Line-Weaver. If you've been around CEREC for a while, you know who Chris is. He's our mentor for years in CEREC. He's from Canada, Calgary. Great place up there. Had a nice time with him just a few weeks ago. This sleeve is phenomenal. Is that it fits on the end of the camera. You got to put the right side to the right side. It's very stable. It triggers the camera very well because of the stability factor. Not only having a distal strut, particularly with the side wings, we're not seeing the artifacts within the screen. I find with the clear shot accessory on the tip of our camera, the Optrogate, and notice how we place the Optrogate in. We squeeze it, placing the bulk of the Optrogate internal framework behind the right and left commissure, and then release. You have it. Here's another secret. Don't place lip gloss on the lips prior to placing the Optrogate in place. What will happen is that will squirt out like you're a fish, and I'm sure you all have had that happen. Wet your Optrogate first. That will provide a gentle atmosphere for the lips. In other words, it doesn't grab and pull the lips around. But don't put the lip gloss on beforehand, otherwise it just won't stay in. You'll notice that with the clear shot, and in most cases, we can place a dry angle between the tongue and the quad that we're taking. Here I'm using the Vita powder spray. Notice how nice that works. We just did a little light mist beforehand to blow out the excess so it doesn't have a grainy look with the reflective medium. As we place the adhesive material, you'll notice how fast and efficient this in the can is. Both the Opti spray, the Vita powder spray, and the contrast spray both work really well. Here I'm using the Vita powder spray. Once you have that accomplished, you'll notice that with the clear shot, it holds the camera in alignment of the arch. For the opposing arch, we lightly tip slightly to the labial, maybe 10 to 15 degrees. Start on the distal and just pull it forward. We're going to take our buccal scan over the canine and first premolar zone. Make sure you have what we call reflective medium, hear me on this, on the connective tissue at the CEJ. That's really critical. That's Klim's new method. Once you've completed the opposing arch scan, our next project is to lightly spray the premolar area on the opposing arch, have them bite down, and verify that. You want to really verify that they're all the way together. Add a little bit more of your reflective medium, and notice that with the clear shot, and even without the clear shot, but I like the clear shot, we don't build up artifact reflective medium on the lens. Klim starts his buccal scan on the upper arch. You'll notice as we place the camera, we have at least about 2 to 3 millimeters of the attached tissue beyond the CEJ. With the clear shot, that will trigger real fast for you. It's a good stabilizing feature. Then we move down to capture at least the CEJ and a little bit of the attached tissue on the lower arch. Now, in some oral situations where they have a deep bite, this is really handy. This will align the lower jaw real well. That attached tissue is not moving. So what does that mean? When we're placing our reflective medium, and this is why Klim likes reflective medium in a can. It's thinner, we need to coat that connective tissue. It's that cervical 1/2 where you see the interproximal embrasures. That's how that buccal scan will just attach on during the correlation process and provide a very accurate result for you. So just to sum it up here with Klim's buccal scan technique, it's accomplished before we prep, it's accomplished in the canine and premolar zone, and it's accomplished in a vertical process. It's not a distal to mesial, it's a vertical orient of the camera from the CEJ and a little attached tissue on the upper arch to the CEJ and attached tissue on the lower arch, and that's either 2 or 3 scans. Now I've tested that for full arch stitching and tested that with shim stock. That's what I do in my spare time. Klim has his gee-whiz correlation study models that are mounted to hold shim stock of 8 microns. Yes, that's what I do in my spare time. I actually enjoy doing that. That's where I test the systems out and develop Klim's process. I'm a clinician. That's where I feel comfortable. The clinical theater is my sanctuary. Using these same principles, I take this concept to the mouth, and that's how I develop my seamless approach to CEREC. I hope that helps. The buccal scan should not be difficult to accomplish. Even in little grandma with just a little valve, we can just lightly pull it back and take a buccal scan anteriorly. It's not hard to do. If you capture a little connective tissue, you're on your way to success, and you should have correlation stitching of the opposing arches basically every time.